Let's go through this breathing technique one step at a time, and make sure you watch the rest of the video, and I will explain to you the physiological reasons why this can be so powerful for you in helping to take you out of what they call the sympathetic dominant hypervigilance fight or flight, like survival mode, that is causing a lot of inflammation, discomfort, pain, tightness, tenderness, all crazy things that we want to not have in your life. This can hopefully help you feel a little bit better. All right, first thing we're going to do is put your feet about shoulder width apart, shoes off preferably so your feet are in contact with the ground. And I want you to internally rotate your hips. That means turn them in. Basically, the toes will turn towards each other like this, but don't go so much that you feel discomfort or pain. Turn them in just a little bit like that, okay? And then you'll probably notice that you're already standing a little bit taller. Next thing you want to do is tongue placement. You're going to take the tip of the tongue, the middle of the tongue, and the back of the tongue, and place that up against the roof of the mouth, trying to keep the tip of the tongue off of the teeth at the top here. All right, the whole thing should be up, and you'll likely notice that your head gets pulled back and you stand up a little bit straighter. Okay, mouth is going to be closed. You're going to inhale in through the nose, arms relaxed by your side like this. Okay, just hanging by your side. When you take a breath in through your nose, take it nice and slow and deep, but try to make it silent, like not a lot of noise. That means you have better control. Now, this is the tricky part. Towards the end of the inhale, you're going to do another very quick second powerful inhale at the end, okay? And this takes practice on getting the timing down, because if you wait too long, you don't have enough space left for the inhale. And if you go too soon, well, then that means you went too soon. It's going to take you a couple of tries to do this. So I'm going to walk you through it. Let's try a couple here together, right? So you rotate it in, tongue at the roof of the mouth, breathe in through the nose, inhale, and near the top of the total inhale, go like this, like a quick sniff, just like that. Okay, and you'll see why you're doing that if you keep watching the video. For now, just follow along with me. Now, at the top, you got all this breath in through here, and now you're going to need to exhale it. This one, you're going to go out through the mouth. Now, in order to do that, you're going to have to open your mouth, and then the tongue has to come off the roof, because you're going to make a particular sound. And the sound is going to be a ha, like an H-A-A-A, big vibration, kind of a deep ha, like this. And this will allow you to have a really long, super exhale getting it out. And that's what we want, because the exhales are really important, because they put you into a more of a parasympathetic, relaxed state. Okay? Now, during that exhale, as you're making the ha, you're going to do something stimulation-wise to your sternum. I like to do what's called a thymus stump, where you're going to take your fist and you're going to make a hammer fist like this, and then put the thumb over the outside, not like this, and you're going to hit this part right in the center of the sternum. If that feels uncomfortable or you don't like that, you can take your fingertips and you can use that. I also like to use vibration massage balls. This is the Stop Chasing Pain Mojo vibration ball. You'll turn it on and it vibrates at the same time. And that feels really great as you're doing that long exhale. And you'll see in the rest of the video, that's going to stimulate your vagus nerve, which runs right along the back of the sternum, wrapping around the esophagus. Okay, but keep watching for that. So when you have that exhale, it's this kind of thump right in the center. Don't thump too hard as to where it hurts. You can use your fingertips or take the ball and vibrate as you do the ha. At the end of that exhale, you're going to repeat the whole thing again for 3 repetitions. Why 3? Well, why not? I mean, you can do more than that if you like to, but start with 3 and you can work up and practice and do as many as you like to do where it feels that it's beneficial. Now, I'm going to go through the whole thing in a sequence now so you can follow along with me. Okay. Internally rotate the hips, toes go in a little bit, arms relaxed by the side, tip of the tongue, middle of the tongue, back of the tongue to the roof of the mouth. Inhale through the nose. Second quick sigh. Out through the mouth as you go. Ha. You can see how long that exhale is, and I don't know if you noticed my Darth Vader voice when I went ha like that. That's really powerful. And then you'll just repeat that a few more times. Okay? When to use this? Whenever you like. I like to do it on a daily basis just to get myself relaxed and calm. Definitely try to do this if you're stressed about anything physically, mentally, emotionally, and I think that you're going to like this a lot. Okay.
Let's start with the hips internally rotated. Remember, that's toes in. That'll put you more into an anterior pelvic tilt. A couple of reasons why I like those. Look at number 3 first. Okay, that's going to put tension on the inner thigh muscles of your leg called the adductors. They're going to bring your knees together. And those muscles will attach to the pubic bone, pelvic bone, and they act like guy wires, which are the wires that you kind of see when you go across bridges, and it adds stabilization. So those guy wires will put tension right there on the pubic bone, and that will go all the way up to the head. And you can see more about that in our video on YouTube about the pubic reset. So that's one of the reasons why I like that. It's going to open up space below your rib cage where your diaphragm is, around the abdomen, and quote unquote your core muscles, so to give it a little bit more room to expand. And you'll also find that will generally improve your posture because you stand up a little taller, your shoulders will go back, and you'll center your head more evenly over your torso. So just play around with how much internal rotation you do with the hips, but remember, never ever cause pain when you're doing it. The tongue position is huge. If you want to know why the tongue is so impactful in relationship to breathing, check out some of my prior videos on my YouTube channel, and you'll be able to see that. So, but basically, the tongue at the roof of the mouth is going to help you improve posture. You'll feel it when you do it. It's going to open up your airway so you actually get more air down into the lungs, and you get that by changing your posture. It helps stabilize the whole body because the tongue is considered a diaphragm. Diaphragms control pressure in the body, and pressure is what stabilization is. Now, nose inhale. With that second inhale, you're going to increase nitric oxide, which vasodilates, expands the blood vessels, so you get more oxygen and blood flow to things. That's always a good thing. You'll send more air to the lower 1/3 of the lungs when you do that second quick inhale. You can look up some of Andrew Huberman's work on that called the physiological sigh. It drives more diaphragm motion just by using the nose, and that helps you breathe better overall. The ha stimulates your pharynx and your larynx, which are the back of your throat and your neck, and those are cranial nerves that come off the brainstem in the back, number 9 and 10, glossopharyngeal and vagus. They are part of your sympathetic nervous system, which will help you relax. That's why singing is so great for relaxation. And it helps you get a long exhale to stimulate your parasympathetic nervous system, because inhaling stimulates the sympathetic fight or flight system. exhaling stimulates the parasympathetic system. So longer exhales for the win. The thumping, where you're just hitting on that sternum in many, many different ways with your fists, with your fingers, your vibration ball, whatever, will vibrate the sternum, vibrate what they call the mediastinum. That's the rib cage region, stimulates the vagus nerve that runs behind the sternum along the esophagus, and will put you into a more parasympathetic relaxed state. And you're going to get a double bonus of draining the lymphatics to get stuck around that sternum, and then they'll be able to make their way in towards the armpits and into the neck. Let me stop the share. In relationship to these positions, you can do this ha and the tapping in any position that you want. Honestly, you don't have to turn your hips in if you don't want to. I just want you to explore different positions that you're in. But the important part is the tongue, it is the ha, and the second inhale when you do it. And listen, I don't really believe that there is quote unquote a right way to breathe, because that's going to change depending on the task that you're trying to accomplish and what you're trying to do with the individual that you're working with. Okay. There are just different ways to breathe. With that being said, let's move right on into the next part of the video.
Talk about the internal rotation of the hips, why we want to do that. Okay. The easiest way to feel why this may be beneficial is to put your hips in the exact opposite position. All right. So when you put your hips internally rotated and your toes in, you get into what they call an anterior pelvic tilt. These big bones here tilt forward, and you'll feel a little bit of an arch in your lower back here, and you'll actually feel like you're standing taller, and you'll get elongated longer in this area here with your rectus abdominis muscles and underneath your diaphragm. Okay. And that's what we want, because we want more room, we want more space for the diaphragm that sits here to be able to drop down when you inhale, because the diaphragm muscle here contracts and pushes down, and the organs push towards the floor, and your pelvic floor underneath that hammock catches the organs so they don't end up on the floor. And then when you exhale, the diaphragm here relaxes and comes back up, and now the organs come in. So basically, it's like a pump in here every time you breathe in and out. Right? Now, where most people live with their posture is the exact opposite. So they are turned out in the hips. So let's try this. So turn your hips out and your toes go out, kind of like a duck walk, and you probably already feel more yucky. Right? What happens then is that you go into a posterior pelvic tilt, your buttock muscles flatten, and what you may notice is that you drop down, like the rib cage drops, your shoulders slump, your low back here, instead of arching, gets flat, and then the head comes forward into what they call a forward head carriage, and the tongue very often is lying in the floor of the mouth, not the roof of the mouth, where it belongs. And then this is the position that everybody lives in. And when you're here, just try this. Try to take a breath in now and see what that feels like. It probably doesn't feel that great, because what are you doing? You're compressing things down and you're decreasing space. Now just try this very simple thing. Turn your hips in and toes in and do the same breath. You probably say, wow, just that, I feel a little bit better. Okay. Now we are overdoing the internal rotation because I really want you to feel that. Okay. Just try to stay out like a duck walk one when you do it. Okay. Now, with the tongue placement, why is the tongue placement so important? Because when you put the tip of the tongue, the middle of the tongue, and the back of the tongue, especially up against the roof of your mouth, what you're going to notice happens is that your head automatically feels like it pulls backwards and it's more centered over your spine. You have better cervical spine alignment, which is what you want, because if you live out here, you compromise the airway pipe in this region. So air is going to struggle to go down this way where it needs to go. So tongue placement is really, really important in relationship to that cervical spine alignment. Okay, so make sure the tongue stays up at the roof of the mouth. And breathing in through your nose is critical because of several reasons. One, you're going to send more air down into the bottom 1/3 of your lungs, so you're going to get more oxygen deeper into your lungs. When you do inhales through the nose, you're going to increase something called nitric oxide, and that is what we call a vasodilator. Dilation means opening up. Vaso is for the circulation. So these pipes that carry the blood flow, which has the oxygen in it, get bigger. And then that's good because they can deliver more good stuff to your cells that need it, because more blood flow is a good thing. Less blood flow, not so much, okay? Because that's what the oxygen actually travels in, is the blood. Does that make sense? Okay. Now, also, when you breathe in through the nose, you're automatically going to use this diaphragm muscle more without having to think about it. Mouth breathers typically use more of the shoulders and the chest and these neck muscles here, which is, okay to use them because they're helping out, but you want most of it to come from down here, and nose breathing helps you do that. Okay. Now, the other reason we're doing that quick inhale at the end, like this is what's called a physiological sigh. And some of you may follow Andrew Huberman, the neuroscientist, and he's talked about this a bit. I'll show you on the rest of the video here that what that's going to do is it's going to give a quick burst of more oxygen down towards the bottom part of the lungs here. So you get more oxygen in, and you'll find that will drive that relaxation response when you do it. Now, why do you want to do the ha like this, even though it sounds freaky? Well, when you do the ha, you're going to be feeling vibration in your throat, in your sternum, and in your abdomen. But you also will stimulate what they call a cranial nerve. And a cranial nerve are nerves that come off the brain stem in the back. You have 12 on the left, you have 12 on the right, so you actually have 24. And you have parts of the back of your throat and your neck here called your pharynx and your larynx. And that's the stuff in here so you can talk, chat, sing, do all those sorts of things. But the pharynx and the larynx are correlated to cranial nerves number 9 and 10. Now, why is that important? Because 10 is the vagus nerve, and the vagus nerve is the most important nerve to put you into a parasympathetic state for relaxation. It also is the number 1 nerve to control inflammation in the body, and the cranial nerve number 9 as well. Both of those are part of your parasympathetic nervous system. So that's kind of important when you want to go into more of a out of fight or flight and begin to relax. That's one of the reasons why singing makes you feel so much better. And when you do the thumping here, or you do the vibration ball, which is my favorite, honestly, you're going to have additional vibration here. But the vagus nerve, you got one on the left, you got one on the right. It comes from the head down the neck, down underneath your sternum here, and it wraps around the esophagus here and goes down and exits into your abdomen. So when you hit here or vibrate here, everything behind this area called your mediastinum, the big fancy word for all this contents, shakes up, and you get some stimulation to the vagus nerve at the same time. And plus, honestly, it just feels good, which is a part of checking the win box there. All right. So I think that you'll see there's a lot of neurological reasons, physiological reasons why this can be so helpful for you. So I'll try to explain that side of everything that I teach. But here's the most important thing. If you do this stuff and it makes you feel better, keep doing it. That's what we want to have for you, to help you every single day to not just survive, but to thrive. Forgot to mention, A common question that I get all the time is, Doc, can I do the same thing while I'm lying down or seated? Absolutely. Explore, practice in all three variations and see which one you like the most. When you're lying on your back, you probably like with your knees bent, feet flat, might be easier for your back, but you can certainly have your legs straight. Make sure you have some support for your head. You can also try turning your toes in at the same time to get some rotation in the hips. And when you're seated, you probably will feel good if you sit closer to the edge of the chair, turn your toes in a little bit as you do the breathing. Give it a go. Share with us which one you like.